now is the moment, because we've had one of the most comprehensive conversations about decriminalisation in the history of the state. A conversation that started in 2017 with the bill to decriminalise, that then went on to a public consultation, that then went to a working group, that then went to a citizens' assembly, that then went on to the Committee on Drug Use. And I think it's been the most comprehensive conversation that we've ever had. So the time is most definitely now. At the moment, we're hearing lots of conversations about a health-led approach, and thankfully we've had a huge amount of expertise from around the world, have really in-depth discussions about what it means to be health-led. To have a policy that is driven in terms of its health outcomes can't be something that is about 3 strikes and you're out, or have any sort of adult caution system built into it, or you can't then be penalised or punished for not taken up on any sort of health appointment or health diversion scheme. So to be fully and comprehensively a health-led approach, it's important that we understand that the decriminalisation of possession, which means the decriminalisation of the individual, regardless of what substance that they may have on them, that they would not face into any sort of criminal justice system at all. We've seen how it's worked elsewhere. If we look at Portugal specifically, we had a 50% reduction in death rates. Ireland has the highest proportion of people who die daily, 2 a day, from overdose, and we know that health outcomes improve under real health-led approaches that are led specifically by what people need. When we think of somebody that we love, that we know, people in our communities, or even strangers that we see on the street that we know may be struggling, we have big conversations now about understanding poverty, about having a class analysis of people's experiences. When we think about institutional abuse and everything that followed that, when we think about what we've been through as a country, and we acknowledge the intergenerational trauma that exists in people's lives, and then we look at how people medicated that trauma, and then we decide that to criminalise those people is the answer to years and generations of institutionalisation of the Irish people and inequities and inequalities that they face every single day in their lives. So what criminalisation does is it criminalises trauma, and it criminalises poverty, and it further institutionalises people. But it also stigmatises and shames people. And I don't think if you work in the field, if you're working in an addiction service, if you're a policy maker, if you were to really examine your core values, if you wanted to stigmatise and shame people for their drug use, I would be really questioning why you're in that role at all. And I think the most important thing we want is that if our loved one was caught in possession, and if that loved one happened to have an addiction issue, it's never the guards that we call. It would never be a judge that we want to determine what happens to that person next. It will always be family, support, love, care, compassion, all of those things, because the criminal justice system does not reduce addiction, it does not reduce drug use, and it never has.